Hello, my name is Keith Ham. I'm the Community Liaison for Integrated Family Services, and we are excited about partnering with the law enforcement agencies in Pitt County to better serve those who have behavioral health issues. Now, the term behavioral health issues includes individuals who have symptoms of mental illness, substance use, and/or intellectual developmental disabilities. And as we begin this initiative, it's important for us to provide education on the partnership, the role of the law enforcement crisis liaisons, and the protocols that should be followed to access the service. We hope that you'll pay close attention to this video to gain a clearer understanding of the program, its goals, and the processes for utilization. There is going to be a pop quiz at the end of the video. We want to make sure that you're prepared. What is the reason for this partnership? Well, nationally, people experiencing a mental health crisis are more likely to encounter law enforcement than medical assistance. What is less common is that law enforcement officers across the country, particularly in small or rural jurisdictions, have access to partnerships and resources that are better equipped to handle such crises and can offer alternatives to arrest. Now, following the national call for mental health options within the public safety system, your leadership have spearheaded efforts to expand your department's response and handling of calls relating to mental health in a manner that provides the highest level of safety and service to all involved. Integrated Family Services, IFS, Mobile Crisis Management Services team, we're the behavioral health crisis responder for your law enforcement agency. And we are providing an on-site behavioral health professional to respond to any law enforcement initiated crisis situations. Now, the service we are providing is mobile crisis management. However, the staff providing this are law enforcement crisis liaisons. They will have an office actually within your agency. In addition to their advanced education, they have received specific training on crisis intervention. Your agency's leadership team has also assisted in orienting them to your agency. What are the benefits of this partnership? Well, first of all, you'll have a behavioral health professional embedded within your agency. That's going to allow for quicker response times, among other things. The individual is going to be assessed by a behavioral health professional. There's a next day follow-up whereby we check in with that individual to monitor their status and to make referrals and linkages to supports in the community that are going to assist them not only in their present crisis, but also in their life beyond the crisis, because we endeavor to complete a crisis prevention plan with the individual. We want to help them to develop strategies and linkages that are not only going to help them in that present crisis, but also to remain out of crisis in the future. And we are a resource for individuals to use instead of contacting 911. One benefit of this partnership is that law enforcement can leave a scene and just simply know that that individual who is in crisis is not left alone. Although we have provided mobile crisis services in Pitt County since 2008, this initiative is going to allow us to provide the service to even more citizens. We are the only mobile crisis provider in Pitt County. However, we provide mobile crisis services to 29 other counties in eastern North Carolina, 26 of them within the Trillium Health Resources catchment area. So this is our RAC card, and our RAC card can be your friend. I'm hoping that you're going to always have at least one of these on you, but I'd like for you to have multiple cards, and here's why. Wherever I go and do presentations, I find masses of people who have never heard of mobile crisis, but would benefit from our services. So we're asking that in addition to participation with us professionally, that you'll have these rack of cards available in your private life. Many times while I was responding with mobile crisis, I would have friends and family members make referrals to us of people in the community or people they knew or worked with. As a matter of fact, my wife was in line recently at Verizon, of course, standing outside, social distancing, when the couple behind her began talking loudly enough for everyone to hear about their adult son with a mental health issue. My wife turned around, she apologized. She said, "I'm not trying to eavesdrop, but I heard your conversation, and I'd like to tell you about a service that might be of benefit." And thankfully, those folks did call Mobile Crisis. So see, not just in your professional career, but also in your private life, please let people know about Mobile Crisis services. In this partnership, it's very important for us to understand the goals of law enforcement, but also for law enforcement to understand the goals of mobile crisis. And one of our biggest goals is this, that individuals can remain in the community. Now, there are states and areas where mobile crisis to them is they have a crisis center and you take the individual to that center. Well, that's problematic on a number of levels, one of which is transportation. Not everybody has the ability to go to another location. But with Integrated Family Services and our mobile crisis, we go to the person who is in crisis where they are in crisis. For example, their living room or their front yard or the parking lot at Walmart. We go out to where they are so they can remain in the community. That's why we have mobility in rural areas, because let's face it, there are quite a number of rural areas in North Carolina, and we strategically have offices and remote mobile crisis workers so that we can cut down on the response time from when a person calls mobile crisis or requests our services. We are an alternative to the emergency department. In other words, before mobile crisis, back in the day, so to speak, if law enforcement encountered an individual who was having a crisis related to mental health or substance use or intellectual developmental disabilities, then oftentimes they would just be picked up and taken to the emergency department, which may not be the most appropriate thing to handle that crisis. We reduce subsequently unnecessary hospitalizations. As a matter of fact, last year, mobile crisis services in the 30 counties that we serve were able to divert over 75% of the individuals that we responded to from an inpatient hospitalization at a behavioral health facility. That works not only for law enforcement, but it also works for the individuals as well, because if you do not need to go inpatient, then that can often be an added burden to you. In relation to law enforcement, our goal is this. We would like for law enforcement officers to be able to refer citizens with problems obviously unrelated to the law and crime, get back to patrolling the streets and let us handle those crisis situations. Another goal is jail diversion. Let me give you an example. I've responded to things like this myself. You have an individual, perhaps at the Sheets, who's hanging around by the gas pumps, speaking to or perhaps arguing with someone who is not there. Obviously, they're in a mental health crisis situation, so you're called out. Could you arrest that individual? Well, perhaps for trespassing or disturbing the peace or something like that, but is it going to do that person any good? Probably not. And so to get mobile crisis involved is going to be better for law enforcement and the individual in question. You see, as a provider of this service, it's our hope to ensure that barriers are removed that keep individuals from receiving the services they truly need if they're experiencing a crisis. both with mental health, substance use, or intellectual developmental disabilities. When they link with our team, we want to promote the safety and emotional stability of those individuals. We want to further minimize the deterioration of the individual that's having that mental illness or emotional crisis. We want to assist them in developing or enhancing better coping skills and link them with natural supports. Help these individuals obtain ongoing care and treatment and encourage services in the least restrictive setting. Let's take a look at an overview of mobile crisis management services. This service is available to anyone experiencing a behavioral health related crisis. And our team, it consists of highly qualified and caring individuals who, by the way, have previous experience in crisis response. Our service is 24/7, 365. Now, we are a short-term service providing crisis stabilization, intervention, and crisis prevention. It's a team structure. Although one mobile crisis worker will respond, they're backed up by a team of licensed clinical social workers, licensed clinical addiction specialists, certified substance abuse counselors, qualified developmental disability professionals, qualified mental health professionals, all available to support that mobile crisis worker that is responding. Also, this service is available to people of all ages, regardless of insurance coverage. So yes, we respond to children, adolescents, adults, senior adults, and there's never a charge to that individual. We're funded by Medicaid, if the person has Medicaid. If they're uninsured completely, there is state funding for mobile crisis and also some third-party insurances. But the important thing to remember is that there's never a charge to the individual we're serving. Response times are always a question. Well, by state mandate, we're given an hour with which to respond by telephone, but it's more like 15 minutes before we've gotten back with an individual. Face-to-face, because we do live in some pretty rural areas, we're given 2 hours with which to respond. However, in looking at our 2020 data, 88% of the individuals we responded to last year, we were there within 1 hour, which is actually kind of amazing if you think about it. You may be asking yourself, well, what is a crisis? Well, a crisis is any situation a person is facing that they don't currently have the coping skills to manage. Having said that, all of us have been in at least one crisis, I'm sure, in our lives. And what may be a crisis for you may not be for me, and vice versa. However, sometimes people are facing a crisis and perhaps they don't have the resiliency or the coping skills that you and I might have. Perhaps there's a mental illness or a substance use or intellectual developmental disability that is hampering their ability to manage the current crisis. And that's when we call mobile crisis and allow us to come in and assist folks who are experiencing those crisis situations. When is it appropriate to call mobile crisis? Well, any situation where an individual is in crisis due to mental health, substance use, or intellectual developmental disabilities are appropriate for mobile crisis. Some examples would be things like anxiety or depression. It could be as serious as suicidal thoughts or maybe even threats of suicide, self-harming behaviors. When someone is considering a petition for an IVC, these times are very much appropriate for mobile crisis to be called. Additionally, there are situational crises such as grief, death, or loss. What I mean by that is, suppose you respond to a completed suicide. Your first thought may be, I wish we could have gotten mobile crisis out here earlier, and that would be our thought as well. But now there's someone else in crisis. It's that family or the friends. And so it's an appropriate time for you to get us involved and let us try to help in that situation. Certainly when there's been domestic violence or family and marital conflict is an appropriate time to call mobile crisis. I personally have responded on numerous occasions to couples who seem to not be able to stop fighting, and they're screaming, or they're in the front yard and the neighbors are calling law enforcement, and you go and you're able to get things calmed down and de-escalated for the time being. But as you're about to drive away, you think to yourself, I'll bet that I'll be back in an hour. That'd be a time to call mobile crisis. And disruptive behaviors, the call for the 12-year-old who's tearing out the walls, quote unquote, of the family house, and the parents don't know what to do. That's appropriate for mobile crisis. And any behavioral health referral where that individual is requesting transport to the emergency department is a perfect time to get mobile crisis involved, because again, remember that over 75% of the people we see do not end up going inpatient at a behavioral health hospital. So the chances are that the person doesn't need to go to the emergency department, or it may not be the most appropriate thing for them in this particular crisis situation. And remember, if we respond and that individual ends up needing to go to the emergency department, we'll transport them there. So again, going back to that goal of law enforcement being able to leave the scene and go back to patrolling the streets. Now, if it ends up being a petition, and we will handle that aspect of it, of course, you'll be called back to make the transport. Let's look at some common objections that law enforcement has to calling mobile crisis and a few potential barriers. In talking with law enforcement officers, some of their objections are this. First of all, it takes too long to wait on mobile crisis. Well, I encourage officers in this way. First of all, 88% of the time we're there in an hour or less. But also, you can look at that time, even if it is an hour or more, as an investment on the front end. Because not only do we want to get you away from that scene as soon as possible, hopefully we're keeping you away from that scene. In other words, you're not coming back in an hour to the same location because we've taken over the crisis there. Secondly, we're hoping that individuals will call mobile crisis directly as opposed to continuing to call 911 when it's not appropriate. So it is an investment in time. Secondly, sometimes officers say, well, mobile crisis didn't do anything. And when I question the circumstances surrounding that objection, more times than not, I find that the officer believed there should have been a petition filed when actually the individual didn't meet the full criteria for a petition. So it's not that we didn't do anything, it's that in some cases we can't do what the officer thinks that we should do. In the way of barriers, it is important to remember that if an individual is in custody already, in other words, you have taken them into custody, we are not able to respond to that individual. Secondly, if they're already under a petition for an IVC, which we know that a petition is a custody order, so they're both custody, just two different instances. We're not able to respond if there is already a petition. If that individual is en route to the emergency department already, we're not able to respond in that situation. And then we're not able to respond to treatment without consent. Here's what I mean by this. Although we have a policy that when law enforcement requests for us to respond, we're going to do that, because even if the individual doesn't consent to our treatment, we are going to help law enforcement in that situation. But where this comes about is, remember when I asked you to pass out those rack cards? Well, let's say that you respond to a situation and it doesn't rise to the level of mobile crisis at that moment. Perhaps the individual in question has left the home. You don't know their location. So you really can't call mobile crisis out because the individual's not there. So you leave one of those rack cards with Aunt Mary, for example, because Uncle Joe has gone somewhere. And you tell Aunt Mary, now when Uncle Joe comes back, you call mobile crisis and they'll come out. You leave the scene. You've not requested for us to come out. Uncle Joe returns home. Aunt Mary calls us. Uncle Joe refuses our services. We're not able to come out in that situation. We cannot come out without consent unless law enforcement requests us. We also can't just provide transportation, and sometimes that call comes in as well. Law enforcement may call and say, listen, can you come pick this person up and take them to the emergency department? Well, no, we can't. That's not how we function. We come out and we'll come out and do an assessment and determine whether or not a trip to the ED is appropriate, but we cannot just come and transport someone. Your agency will request mobile crisis management services through the IFS call center. Now, once the dispatcher or law enforcement officer deems the need for a response by the law enforcement crisis liaison, they will make that request by calling 1-866-437-1821. And for all requests from law enforcement officers, we do streamline the required demographic information. We are looking for the name and number of the officer, also the name and hopefully a phone number for the individual we're responding to. We're going to ask for a description of the crisis, suicidal thoughts or threats or depression or anxiety, whatever the case may be. Obviously, we need an address where to respond. We also ask that we be informed of any safety issues, for example, weapons in the home, history of assault charges, and etc. And the reason for the referral that we discussed just a moment ago. Once that law enforcement crisis liaison arrives, provide any additional collateral information that can assist with the crisis intervention and the assessment process. If there are no safety issues, the law enforcement officer is welcome to leave the scene. And then, obviously, law enforcement officer needs to complete agency-required reports or documentation. Now, the law enforcement crisis liaison will be embedded in your agency 7 days a week during the agreed upon hours. Referrals for mobile crisis outside of the time that your crisis liaison is in the agency will be the same way. You access the IFS call center at the 866-437-1821. Following the screening process, your responding law enforcement crisis liaison will contact the law enforcement officer to introduce themselves and provide an estimated time of arrival. Now, once the crisis liaison arrives on scene, they'll reintroduce themselves and engage with the individual to begin the de-escalation and assessment process. Although some of our referrals with mobile crisis result in a telemedicine or telephonic response, it's important to note that all referrals from law enforcement will result in a face-to-face response. That crisis liaison will de-escalate the crisis while completing a comprehensive crisis assessment that assists with creating a crisis plan to prevent a future crisis from occurring. The law enforcement crisis liaison will also consult with a licensed clinical social worker or a licensed clinical addiction specialist or a psychiatrist as needed prior to leaving the scene. If this consultation results in linkage with the emergency department or a detox facility or an inpatient hospitalization, or perhaps a petition for involuntary commitment, the crisis liaison will assist with this linkage and discharge the individual from services. If the consultation results in that individual remaining in the community, the crisis liaison will assist with a referral and/or linkages to services needed. They will also conduct a face-to-face follow-up within 24 hours of the initial crisis. Now, to ensure appropriate follow-up and coordination of care, if there are multiple requests for response by the law enforcement crisis liaison, the mobile crisis services supervisor may assign the case to a staff that is assigned to the local IFS office. Once a referral and/or linkage is made, the law enforcement crisis liaison will discharge that individual from mobile crisis services. Within 48 hours of the response, the law enforcement crisis liaison will email the requesting officer information that will include the following: the date of referral, the disposition of the referral. In other words, did they remain in the community? Were they linked with services? Were they linked with detox? Or perhaps the individual refused further follow-up. There will also be a satisfaction survey link included in the email, and we will discuss that at a later slide. For dispatchers, you can contact mobile crisis directly when no law enforcement response is needed. The way this would work is an individual has called in to dispatch. They do not need a law enforcement officer, but would benefit from mobile crisis services. If that's the case, we ask that you receive verbal permission from that individual to link them with mobile crisis, the crisis liaison. Keep them on the phone and reach out to our call center at 866-437-1821. Provide the call center specialist with the name and number of the individual, as well as the dispatcher's name and number, a brief description of the crisis, the address of the response if known at the time, and please inform us of any safety issues. And then you can bring the individual on the line with our call center specialist for a warm transfer, and we'll take the call from there. Our agency will be meeting with your organization on a monthly basis to monitor progress and key performance indicators. Key performance indicators, or KPIs, are indicators of the progress toward an intended result. KPIs provide a focus for strategic and operational improvement. They create an analytical basis for decision making and help focus attention on what matters most. As business expert Peter Drucker famously said once, "What gets measured gets done." Now, some of the KPIs are measured by your agency, and some are measured by Integrated Family Services. The agreed upon key performance indicators include a reduction of frequent responses to known individuals with behavioral health issues by 50%. We will receive a list of names from the individuals who are frequently known to contact 911 from your agency. Our goal will be to ensure extra efforts will be made to implement crisis prevention activities to prevent a future crisis, thus preventing the need to contact 911 in the future. Additionally, divert 80% of the individuals served from the emergency room or an inpatient hospitalization at a behavioral health facility. Another indicator 85% of individuals who consent to behavioral health treatment are linked to those behavioral health resources and services. 85% of calls related to a behavioral health crisis issue should involve the law enforcement crisis liaison embedded within your agency. We recognize that not all calls related to behavioral health crisis will be referred because some of them may present with safety issues that would put our staff at risk. 50% reduction in number of individuals with behavioral health issues and have been involved with nonviolent crimes from incarceration. And finally, decrease the use of 911 by individuals with a behavioral health issue by 50%. Of course, that does not involve criminal, violent, or life-threatening situations. To assist with evaluating our implementation process, we're asking that each law enforcement officer complete a satisfaction survey that will be reviewed and utilized for qualitative purposes. This will be done for at least the first 60 days of implementation. Within 2 days following the response of your law enforcement crisis liaison, you will receive this link via an email along with the outcome of the referral. Where appropriate, you'll be able to select agree, disagree, or not applicable. In other areas, you will have the option to include comments. Your feedback is vital to us, and we value your input. Communication is the key to our success in this endeavor. And by partnering together and keeping lines of communication open, we can achieve our goals of assisting those in crisis and relieving the undue burden placed on law enforcement. Great, we have come to the portion of the presentation where we will have our pop quiz. So, true or false? Integrated Family Services Mobile Crisis Management Team is embedding an on-site behavioral health professional, referred to as a law enforcement crisis liaison, to respond to law enforcement initiated crisis. True or false? Go ahead and formulate your answer at this time. And the answer is true. Absolutely. All right, true or false again. To access your law enforcement crisis liaison to request community response, contact them directly. True or false? And the answer is false. That's right. All requests should go through 866-437-1821 to ensure a seamless referral process. You know, your law enforcement crisis liaison could be responding to a call with another officer. And if this occurs, we need to have another staff member who is not assigned to your agency respond to that crisis. So all requests should go through the call center at 866-437-1821. As a matter of fact, this would be a great time for you to go ahead and program that into your phone. I'm going to give you just a couple of moments to do that before I continue with our pop quiz. True or false? Another 50% chance that you're going to get it right. No, I'm just kidding. I'm sure you're getting them all correct. The completion of the satisfaction survey makes me a valuable member of this project because my feedback is valued and appreciated. I hope you know that the answer to that one is, that's right, true. Absolutely. You are a valuable member of this project. Feedback, communication, remember, is the key to our success in this endeavor. Another true or false? My role as a law enforcement officer does not impact the key performance indicators, or KPIs, of this project. Is that true or false? It's false, right? Your role directly impacts the project's success and outcomes. And remember, those KPIs will have a tremendously positive impact on the community and your agency, and your role is absolutely vital. All right, true or false? This is our last one. Are you ready? Mobile crisis management should be called if you respond to a call where an individual is reporting thoughts of suicide and requesting to be transported to the emergency department. This one may be a little tricky. I'm going to give you just a moment. True. That's right. The answer is true. Your crisis liaison can respond, complete a thorough suicide and crisis assessment to determine if the individual absolutely needs to be linked with the ED. Now, if the individual has no weapons and presents with those safety issues, you're able to leave the scene of the crisis. And most of the individuals served who report thoughts of suicide do not have a plan and need to be linked with community resources as opposed to the ED. We can assist with that. We can link them with community resources and hopefully prevent a future call to 911. If the outcome of the assessment indicates that the individual does need to go to the hospital, your crisis liaison can transport. Thank you so much for taking the opportunity to view this training video on the partnership between Integrated Family Services and your law enforcement agency. We hope you now have a better understanding of the program, its goals, and the processes for utilization. We welcome and invite you to send questions to the link you see pictured on this slide. It should have been included in the email with this video. We will respond to you via email or phone, whichever is your preferred method of response. Our job is to not only serve individuals in the community, but to collaborate with key stakeholders, such as yourself, to jointly make our community better. We look forward to enhancing our partnership and the ability to partner with your agency in connecting the pieces to improve the lives of others.